Now I'm honored to introduce today's speaker, RuthAnn Batchelder. RuthAnn served as a devoted caregiver for 25 years to her husband, Lance, who was affected by LCH and ECD. We're excited to have you with us today, and I hope you enjoy the session.
Thank you, Belinda. Hello, everyone, and thanks for being here. Thanks, Belinda, for that introduction. I'm really excited to share this with you today. So let's get started. First of all, let me tell you a little bit about myself. My name is RuthAnn Batchelder. I was caregiver to my husband, Lance, for over 25 years. He was diagnosed with Langerhans cell histiocytosis in 1995, just 15 months after we got married. And at that time, we joined the Histiocytosis Association of America. And through the years, we went to a few of their conferences to learn as much as we could about LCH. And then in 2006, he was diagnosed with ECD. In 2008, I decided to have a fundraiser for the Histiocytosis Association. And it was after that fundraiser that I realized, or we all realized, that any money raised was going to go to all of the diseases combined. There was not a specific focus on ECD. And in talking to a couple of doctors, including Lance's oncologist, who had been a research doctor, we were told that the way to get focused treatments was to start our own organization. So I helped start the ECD Global Alliance, and I served on the leadership team starting in 2008 for about a year and a half until Lance's health began to change and I needed to stay at home and focus on him more. So then I was more in the background. Then in 2013, I attended the first ECD Global Alliance patient and family gathering in San Diego. And I realized during the caregiver session that all of the caregivers were struggling with the same things that I was struggling with. So it was then that I started the ECD caregiver group, and I co-led that with Julie Jones for several years until Lance's health began to deteriorate and I wasn't able to do it anymore. And he passed away in 2020. I have been involved off and on with the ECD Global Alliance since that time as I've been able. And there is one thing that I would like to mention before I go into the rest of this is that the reason we started the ECD Global Alliance was because we wanted to find effective treatments for patients. By the time those treatments were available, Lance's disease had progressed to the point that it was not reversible. And so hearing from patients and caregivers now that the patients are doing well, that makes me so happy. And I want you all to know that anything that I share here, you may not be able to relate to some of the struggles that we went to or that we went through, but I want to assure you that I am very, very happy that you are not going through these struggles if you're not. So anyway, let's get going. Number one, what we always need to do is be kind to ourselves. And in doing that, you are able to better take care of your loved ones. So make sure that you prioritize self-care. That is getting enough sleep, making sure that you get exercise that gives you those endorphins that you need to feel good. Get outdoors and get some sunshine. That does the same thing for you. Take a break. Burnout can happen really fast. I was burned out a lot. And I would find that when I would get snappy with Lance or with caregivers that we hired to come into our home, I knew that I was beyond burned out and I should have taken a break a long time ago. So make sure that you take your breaks. And one of the things that I didn't put on here was eating healthy. And that is really important, eating healthy, nutritious meals, because that is your fuel that will get you through your days and it will make things easier. And I apologize too. I woke up with a scratchy throat this morning, so I'm probably going to be drinking a lot of salt water here. Okay. Respect your limits, but you also need to know what your limits are. As a caregiver, I often felt like I needed to be superhuman, and I did more than I knew that I could handle. So make sure that you know what your limits are and that you are sticking to those limits and not doing more than you are able to. Give yourself grace. You need to acknowledge that you are doing the best that you can in this moment. Don't be so hard on yourself. Ask for and accept help. That is something that I struggled with a lot, especially in the beginning. It is really hard to ask for help. So one of the things that I did that made it easier in the later years was I put together a list of things that I knew I would be okay having people help me with, such as going to the grocery store or helping prepare a meal. During the holidays, helping wrap presents, taking Lance to help him purchase gifts for me and others, things like that. If you have a list, then when somebody asks if there is something that they can help you with, you have that available. Because I don't know about you, but when I was caring for Lance, sometimes I would be so overwhelmed that when somebody would ask me what they could do to help, I couldn't think of anything. So having that list was key. The last one is acknowledging your feelings. This is a hard life being a caregiver, and during the holidays, it can be especially stressful. And acknowledging that and being able to talk to somebody about it is very important. If you don't have a trusted friend that you can talk to, then maybe seek out a counselor. Having a plan. I am a planner, so this was something that kind of came naturally to me. But it's not something that you really think about. One of the things is being aware of your expectations versus what the reality of the situation is. We all have that image of a perfectly calm, joyful family gathering where everybody's getting along and laughing and having a great time. But the reality is that these gatherings can be chaotic and they can be challenging. So be realistic so that you're not upset that things didn't turn out the way that you expected them to. And also realize that people often hide their problems, especially during the holidays. So someone's overly positive attitude might not be the truth of their situation. Try not to compare your life to theirs or to others, because there really is no comparison anyway. Communication is really important, and setting boundaries was one of the biggest things that I did to help us. I would tell people ahead of time that we would only be there for an hour, or if we were planning on being there for the entire celebration, I might tell them ahead of time that we might need to take a break sometime and go for a walk or just go off into another room because we can get overwhelmed. It just depended on where we were in our life at the time. Also, say no when necessary. And that goes back to knowing your limits, and it is okay to say no. Teamwork. That is partnering with your loved one who is sick. Agree on what the plan is so that you're all on the same page and there's no confusion. How much are each of you comfortable sharing with other people? Avoid topics or places that might be triggering. For us in the beginning, it was hard being around celebrations where people were exchanging gifts that we knew that we would never be able to exchange with each other again, say a ski trip or something like that. So we either avoided those situations, or if we couldn't avoid them, then we would let people know we're only going to come for a short time. Be honest with people and let them know that you're having a challenging time, but also know that you don't have to share more than you feel comfortable sharing. Also, think about the location of any of the events or activities and the accessibility or comfort of your loved one. We stopped going to people's homes where either of these were an issue because it was an added stress that neither one of us needed. Adapting traditions. Perfection is not the goal. Prioritize those activities that are most meaningful to you. What will create the best memories? How much can you handle? That again goes back to knowing your limits. Can you break activities down into multiple steps or multiple days instead of doing everything at once? There's also starting a new tradition. Focus on what you can do instead of what you can't. Early on, Lance and I started a tradition of hosting the holidays at our house and having people, our friends and family members who didn't have anywhere else to go, they would come over for the meal. And that was something that we all benefited from. And then in the later years, I stopped putting up a tree because it was just too much work and we didn't really have the room for it with all of Lance's medical equipment. So instead of that, I would take him out to see the Christmas lights, all of the displays around the area, and we would invite our friends and family to go with us. And that was really fun. Also adapting or adjusting meals. Lance had a lot of dietary restrictions the last decade of his life, but food was a huge thing for us. So I made sure to still have that big meal and I adapted the food to his needs. And then there were a couple of years that it was really challenging for me. So I ordered the meal catered through the local grocery store, and that was very helpful. Creating new memories. The last decade of Lance's life, I gave him gifts starting at the beginning of December, and I gave them to him all the way through up until Christmas. And he absolutely loved that. I've got so many pictures, and those are some of my favorite memories, that along with the memories of taking him to see the Christmas lights. So adapting traditions and creating new memories, that was really important for us because of the challenges that we faced. One of the things that you can control, because there's so much in this life as a caregiver that you cannot control, but you can control your mindset and you can control how you respond to situations. First of all, find your community. Surround yourself with people who support and encourage you. Limit the overly positive or the overly negative people, because that can affect you in not good ways. And if you cannot avoid them altogether, then try to limit your time with them at least. The other is be in the moment. You don't want to be thinking about the past. You don't want to be thinking about the future, because both of those can rob you of the joy that is happening right here in front of you in this moment. And for me, while I was caring for Lance, that was thinking about the past was something that also reminded me of the losses. So I had to stop doing that so that I could really enjoy what was going on right now. Practicing gratitude. This is something that can be hard to start this practice, but it is so important. This is what has helped me the most out of everything that I have done, is practicing gratitude. And that doesn't mean pretending that there is nothing challenging in your life. What it means is acknowledging the good things in your life and having gratitude for them. Journaling is something else that I've done that my entire life. It has helped me, especially during the really challenging times like the holidays, when I can sit down, write out all of the things that I'm going through, the hard feelings that I'm having, put it on paper, close the book, set it aside, and not have to think about it so that I can enjoy the company of the people around me. And the last one is being intentional. And that is really being purposeful in what you do. Be honest with yourself about what your needs are, what your loved ones' needs are, and following through on that. It's about self-preservation. That's what it was for me. And it is not selfish to look out for yourself and your loved one, especially when you are struggling. I did have a lot of people, and I've heard this from other caregivers too, that we were told that we were being selfish because we were focusing on what our needs are. And what I found was that people who are not dealing with a chronic illness, your loved one might not look sick, so they don't understand the challenges that you are facing. And it's not being selfish for you to look out for yourself and your loved one. You need to do that. This one I came across and I really fell in love with this. The joy of missing out. This is another mindset thing. Early on, I felt so much like I was missing out on things. And being able to change your mindset so that you feel content with staying in. And it's almost like giving yourself permission to disconnect and take care of yourself. So this was one that that's another mindset thing. And looking at all this from the other side, after having been a caregiver, all the things that I did, all the things that I've talked about definitely made it easier on us. It made it easier for me to be a caregiver. It made it easier for me to enjoy the holidays, but it was still challenging. There's no magic pill that's going to turn it into a perfect situation, but having the right mindset, being intentional and purposeful, setting boundaries, and practicing self-care are all things that will help. Here are some resources. These are resources that are good any time of the year. The Caregiver Action Network, caregiveraction.org, Family Caregiver Alliance, caregiver.org. Those are two resources that I use for at least the last 12 years that Lance was alive. And there's a lot of great information there. So if you need resources as a caregiver, I would point you there first. If you are a caregiver of a U.S. veteran, the Department of Veterans Affairs has a caregiver program, and they've got a lot of great resources. You can look them up at caregiver.va.gov. And for those who care podcast, this is a podcast that I started this year. It is telling my story of the life that I lived with Lance and the things that I experienced as I cared for him and the things that I'm experiencing as I move forward in my life after losing him. It is available on all podcast platforms. You can find it on my website at forthosewhocare.org. If you click on the YouTube link, I did decide to do the video element because as a caregiver, I lived a very isolated life. So I thought the video element would be good for anyone who is living an isolated life. And you can find that again at forthosewhocare.org. So that's all I have for you. Does anyone have any questions?
Okay, so we'll take some time to read and answer some of your questions. And I do have one. Says, our family has financial struggles in addition to all the other issues ECD brings. Do you have any tips for how to deal with that during the holidays?
Ah, I actually did write something down about gift giving because we did have some financial stress with that too. And also the time of losses. So here are some of the things that I did to adapt to that. We stopped buying gifts for others completely, but we didn't have children or grandchildren. So that was easy for us to do. If you can't do that, you might consider doing a name exchange where everyone buys one gift instead of buying gifts for everyone. And then let's see here. Yeah, I think that that was the biggest thing for us with the financial stress during the holidays. And also when we would have people over for the dinner, we started making it a potluck so that we weren't having to take on the full cost of the dinner, the meal. So people would bring things with them.
Okay. Next question is, how can caregivers ensure that the loved ones are comfortable during travel or large gatherings?
Mm. Well, I would say that you need to know what their needs are before you leave. And that's where having a plan in place comes into play. What are their needs? What are their dietary restrictions? Do they get cold? Do they get hot? Make sure that you have the appropriate clothing for them. Make sure that you have their medications, any medications that they need. I had it set up so that I had a whole bin full of things that just stayed in my van. And then I had a carrier that I carried all of Lance's medications with us whenever we went anywhere. And I made sure that I had enough for a few days because you never know what's going to happen, especially during the holidays. If you get snowed in somewhere, you want to make sure that you have all of that. So talk to the people. If you're going to someone else's house, talk to them ahead of time and let them know what you need. If there's a specific type of seat that they need to be in, such as a recliner, or if they need to sit on a hard chair, if they need blankets, bring a blanket with. Whatever it is that you need, make sure that, or that your loved one needs, make sure that you have all of that with you and that you communicate.
Okay. Okay, the next question. Our family doesn't understand that what we're dealing with. They get upset because we can't always participate in family traditions. I don't know how to explain our issues with them. I want to maintain our family relationships. How can I do that?
That's a really good question. That is something that we struggled with all the years that Lance was alive, because he didn't look sick. And I think that one of the things that really helped us was making sure that we shared with them constantly all of the things that were going on with Lance. We always let them know he's in the hospital, he's having a surgery, this is the treatment that he's going through, these are the symptoms. And when they didn't believe that, I would refer them to the ECD Global Alliance to check out some of the things on that page. There are also other resources that you can find on the caregiver websites that I pointed you to. I use those a lot. I would come across articles that felt relevant to the situation, and I would ask our family and friends to read those so that they could understand. It is really difficult to understand when you are not living that life, but that doesn't make it easy for us. So communication is key.
Okay, we have, let's see, have one more. Can you provide some guidance as to when one should seek additional paid help and for how long?
Oh, wow. Um, that again that's going to be dependent on each situation. I think that if you feel like you are getting burned out, if you feel like you are so overloaded that you can't do anything to even care for yourself, or you're getting to that point, it's time to seek out help. And in the beginning, I had paid help for the last 12 years of Lance's life. So what I had paid help for was so that I could get out of the house and get a break. And I tried to do that at least once a week so that I could get away and recharge so that I wouldn't be snappy with Lance.
Okay. And I believe this is our last question. Let's see. How can family and friends better support caregivers during the holidays?
Um, support. Can you read that question again?
Yeah. How can family and friends better support the caregivers during the holidays?
I think just asking what you can do to help, that was something that really helped me. And instead of saying, let me know if there's anything I can do to help, think of something that you would be willing to do and offer to do that, such as the things that I mentioned in the beginning, picking up groceries, helping prepare a meal, taking the person who is ill shopping, coming and sitting with the sick person so that the caregiver can get out and get a break. There are a lot of things that you can do to help ease that burden, and just communicating with them, asking them if they need to talk, if they just need you to sit with them.
Okay, it looks like we've addressed all the questions. Thank you, Ruth Ann, for a great presentation.